I've been asked to come and do an abdominal assessment on you. Would that be okay?
Yeah?
Great. Before we start, I just need to know, are you in pain at all?
No.
No. Do you need to go to the toilet at all?
No.
Okay, great. Thank you very much. So before I start, I'm just going to have a quick look at you and just check and see if you've got any equipment around here. I've noticed there's no vomit bowls or anything like that. And we've already taken your history, so I know that you haven't been vomiting and I know that you don't have any current nausea. So what I like to do to start, if that's okay, is I'd like to have a little look at your hands. Lovely, thank you. So I'm just going to turn them over. So I'm just looking at your nails now. And when I'm looking at your nails, I'm looking for any white marks on the nails, which would suggest leukonychia, or any spoon-shaped nails, which would suggest koilonychia. And these are things that we look for liver disease. So now I'm going to move your palms over. I'm looking for any reddening in the palms, any palmar erythema, and I'm also feeling for any dupitans contractures, any fixed flexions of the fingers there, which you don't have. So next thing I'd like to ask you to do, Molly, if that's okay, if you could put your two thumbnails together for me, fabulous, and the next two nails for me, and the next two nails, and the next, and the next. Great. Okay, so we're looking for that triangular shape there, which we can see more like a diamond shape. So we're looking for the angle of the nail, and we're looking for signs of clubbing, which can mean other sort of significant long-term health problems as well as kind of problems with the liver as well. So now I'm just looking up to your face, and you look very comfortable. You don't look distressed at all. What I would like to ask you to do, if you could pull your eyelids down for me. Okay, and I'm just comparing the conjunctiva on each side. Thank you, that's fine. And they both look nice and pink, no signs of any anemia. And just looking around the eyes for any xanthelasmata, so any signs of any cholesterol deposits, which you don't have. And just looking around your mouth, at the corner of the mouth, for any angular stomatitis, so any drying of the skin that can suggest vitamin deficiencies, and looking inside the mouth as well, if you can open your mouth for me. Fantastic. And I should shine a pen torch really to have a look, but I'm looking to see your tongue looks nice and moist and healthy, and your teeth look nice and healthy as well. Do you have any ulcers in the mouth or any sores, anything like that?
No.
And your mouth isn't sore, so no sign of any glossitis on the tongue, and I didn't notice any dental problems when I looked either. So now we're looking down at the chest. So I'm just looking for any signs of any spider nevi. Up to 6 would be normal. Of course, spider nevi is often an indication for liver disease, although, as I said, it can be normal. So up to 6 can be normal. If I can just sit you forward, just looking at the top of your back as well for any spider nevi, which I can't see. If you just want to pop yourself back, great. I'm just going to pinch your skin. I'm just going to check for any signs of hydration, although I'm not worried about that because your mouth looks nice and pink and moist, and your mouth, your lips don't look dry either, and the skin goes back nice and quickly, so I'm not worried about any hydration problems. I'm just going to touch your chest now, so I'm just going to feel across the top here, and I'm feeling for a particular lymph node. We're feeling for Vercoe's node, which is based on the left side there, which I would be worried about and can be significant in some kind of abdominal cancers, but certainly I can't feel a mass there. Great, thank you very much. So the next thing we're going to do is have a look at your abdomen. Okay, so for this I need to lay you flat, is that okay?
Yeah.
Do let me know if you're uncomfortable at all. Down slowly if you can. Okay, you're comfortable there?
Yeah.
So what I'm going to do, if I may, I'm just going to expose your tummy just down a wee round further. Fantastic. And just keep your hands by your side for me. Fantastic. So from the bottom of the bed, I'm just having a look. I'm looking at the general shape and the contour of the abdomen, and I can't see any obvious masses. The abdomen looks nice and even on both sides, a nice flat tummy, and nothing that I can see that is concerning me. So the next thing I'm going to do is look from the side. So this time I'm looking to try and locate the aorta. So I'm looking down Molly's abdomen, and I can just see a nice light palpation here. It's not expansive, it's just a nice expected pulsation that I can see there, which will be the aorta. Now having a little closer look, I'm looking to see if Molly has any scars that I can see, any tattoos, anything else that I might note. And on a real patient, I might also ask her to expose the chest area so I can look there. And you've not had any abdominal surgery, you were telling me?
No.
No. Okay, fantastic. And I can't see any scars there to worry about. And nothing else of note on the abdomen. So now I'm going to get my stethoscope. And I'm going to have a listen to your abdomen, Molly. First of all, over where we saw the aorta. Sorry, this is just a little bit cold. And I'm just listening for any aortic bruise. And now I'm moving my stethoscope to listen for bowel sounds. I can hear the bowel, sounds nice and active. So no absence of bowel sounds, no high-pitched bowel sounds, which would suggest any kind of bowel obstruction or complete bowel obstruction, and that doesn't sound like the bowel's hyperactive either. So good, normal sounding bowel sounds. I can also, if I wanted to, listen for renal bruits, which would be on either side of the umbilicus region, but I'm not going to listen for that today, but that is something else that we could do. So the next thing we're going to do is feel the abdomen. So first of all, Molly, I'm just going to place 2 fingers over the aorta. And I'm just feeling if I can feel that nice light palpation. It's quite difficult to feel, but I can feel it, so I don't need to measure it because it's only a light palpation. But if I wanted to measure it, I could look at finding the aorta and almost pinching between my fingers to get to try and feel the outer edges of it, to try and make an estimate of how large we thought the aorta had become. But I'm not worried about that, so we don't need to do that right now. So now we can move on to look at light palpation of the abdomen. So remember, it's important to look at your patient when you're doing this. So Molly, I'm going to be looking at your face to see how your expression while I'm feeling your abdomen. And we're going to go into all of the 9 areas of the abdomen. So I'm going to start in the right hypochondrium, epigastric region, left hypochondrium, left flank, you may call it lumbar, that's fine, right flank, umbilicus, left iliac fossa, suprapubic, right iliac fossa. And I've looked at Molly's face all the way and none of that seemed painful.
No.
Okay, so now I'm going to feel a bit deeper if that's okay. So all of the same areas as before, I'm just rolling around in your abdomen now. Just looking for any masses. And if I find any masses, then I'm going to note the size, the shape, the contour, and obviously if Molly's in any pain, those masses that I found. Okay, and you don't appear to be in pain, and I can't find any masses. Okay, so now we're going to move on to look at organ assessment. So the first organ that we're going to look for now is going to be your liver. So because we know the liver can grow downwards, I'm going to start my palpation quite low. So what I would like you to do, Molly, is take a nice deep breath in for me. And when you take a deep breath in, I'm going to move my hand in. And if you take a deep breath out, and again, deep breath in, and out, and deep breath in, and out, and deep breath in, and out. Sorry, Molly, and deep breath in. Okay, and that's, I can just feel the liver edge coming down to touch my hand there. Feels nice and smooth, doesn't feel hard at all, doesn't feel like the edges are irregularly shaped as much as I can feel. So now I'm going to do the same, but I'm going to feel across with the spleen, so we're going to be going all the way across this way. So again, if you could take a nice deep breath in for me, and out, and in, and out, and in, and out, and in, out, and in, and out. And I can't find the liver edge, the spleen edge, and I'm not expecting to. I would only find it if it was enlarged, because it would start to grow over to this side. So the next thing I'm going to feel for are your kidneys. So I don't want you to help me at all, but I'm just going to put my hand around into your back, and feeling for your spine, feeling for your last rib, And then just take a nice deep breath in and out for me. And as you relax, I'm just going to squeeze your kidneys. Okay, I'm just going to do the same on this side. Take a nice deep breath in and out. I'm just going to squeeze. And is that sore at all on either side? No. So really I'm just looking for tenderness with that, and I'd only ever find the kidneys if there was a massive cyst in there. So we can't find the kidneys either. So that's good. So the next thing we're going to move on to is looking at percussion. So with this time we're going to percuss the liver to get an idea of the size of it. So in the mid-clavicular line, starting again in the right iliac fossa, we're going to percuss upwards. So the change here, could I just ask you to pull your bra up a little bit out of the way? Marvellous. And there's the change back to resonance. So if we measure the liver where we find it, it's going to be about 5.5–6 centimetres, which is normal. Between 6 and 10 is normal. Now for the spleen, I can either start across here and go all the way across, or I can start down at the bottom and come all the way up, or if I want to, if I'm confident that I now know what this sound is, which is tympani, if I find the anterior axillar edge and feel for the last intercostal space, and that sounds tympanic. So there's no dullness there, so we're not expecting that the spleen is enlarged at all. We could, if we wanted to, if we're worried about retention and we want to check to percuss the bladder, we can start from just above the pubic line and come up to the umbilical region. We're not worried about that with Molly. Equally, if we're worried about ascites, if we notice that maybe she's got some jaundice or some other signs of liver problems and we were worried about fluid retention, we could think about shifting dullness, where we percuss across the abdomen, and then if we find dullness, we ask her to turn, to wait for the fluid level to drop, and then percuss again. And where it is dull, it should now be tympanic. Other special tests that you may see be something like rebound tenderness, so where we're testing for appendicitis, so pressing in on the abdomen, which might be tender but shouldn't be as tender as when you release it. And then other special tests as well we can think about doing would be Murphy's sign if we're thinking about cholecystitis, where we press down underneath the rib, although that could be quite tender for the patient. Other things we might think about doing are hernia assessment, so placing our hand over where we think the patient may have a hernia, so umbilical region, asking the patient to cough. Could you cough for me, Molly? And then thinking about the inguinal and femoral area and asking the patient to do the same. And then to finish off, we're thinking about edema, so looking at the ankles, doing a 15-second press to the ankles and then releasing and seeing if there's any indentation of the fingers. And that is the end of my abdominal assessment. Thank you, Molly.